To the latest on the pandemic now, Pfizer has announced its 3-dose COVID-19 vaccine produces strong immune response in young children under the age of 5. That news coming as cases are on the rise in Michigan. Our state now averaging 4,100 new cases a day, according to our last update from the health department. Chief Health Editor Dr. Partha Nandi joining us now. And Doc, Pfizer started with a 2-dose series that didn't really provide much protection for young kids. How much protection do the 3-dose regimen give?
Yeah, you know me, Brian, I'm excited that we're a big step closer to getting our littlest ones protected. Why? Because I have a 2-year-old who falls in this age group. As I mentioned before, Pfizer started out with 2-dose, which did not provide adequate protection. So the clinical trial was amended and a 3rd shot was added. This phase 2 and 3 trial included just over 1,600 participants. Antibodies were tested 1 month after the 3rd shot, and preliminary data found that 3 doses were 80.3% effective at preventing illness during the Omicron wave in kids younger than 5. Now, this all sounds fantastic, but 80.3% is not the final efficacy rate, not the final rate, because Pfizer needs at least 21 symptomatic cases in the kids that were vaccinated to determine if the effectiveness, what it is right now. Now, 10 have been identified, so more data needs to be gathered.
All right, so what's the dosing amount here, and are there any concerns about safety? And then lastly, when will Pfizer file with the FDA?
So all important questions. The kid-sized doses are 3 micrograms each. That's about 1/10 of what we as adults get. The first 2 doses were given 3 weeks apart, just like adults, but the 3rd shot was 2 months after the 2nd shot. As for safety, there were no new safety issues found, and the vaccine was well tolerated. Now, Pfizer plans to finish their FDA application this week, and FDA's scientific board has a meeting scheduled on June 15th to discuss vaccines for kids under 5. Now, that includes, we talked about this before, Moderna as well. Moderna submitted its data for kids 6 months to 5 years of age back in April. If approved, that age group will be given 2 doses, each 25 micrograms, 28 days apart. Now, once again, I'm quite excited, as you can tell, that we'll likely have vaccines for our youngest kids in the near future. As I said, I have a child in that category who's not yet vaccinated, and he's the only one in our family who's not protected. I know there's a lot of controversy. Not everybody agrees on vaccines, especially for kids. But let's not forget how hard Omicron hit our littlest ones just a few months ago. According to the CDC, newborns up to age 4 were hospitalized with COVID roughly 5 times the rate of the previous peak during Delta. Some even died. So there are many parents like myself who are anxiously waiting to vaccinate their kids against this very contagious virus. And we do that. What we're trying to do is get more and more folks vaccinated and protected so we decrease the spread of this virus.
And that is the goal. All right, Dr. Nandi, thank you. Appreciate your time as always.
My pleasure.
And if you have a coronavirus question for Dr. Nandi, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter. Glenda?